Can everyone see that? All right, great. So now I'll turn it over to Christine Molden to introduce the rest of our team.
Hi, everybody. My name's Christine Malden. I'm a nurse case manager, and I work at Kennedy Krieger in the Specialized Transition Program, which is our intensive day program at Kennedy. And along with me, I have our patient care coordinator, Noelle Grissinger, our occupational therapist, Haley Holt, and our physical therapist, Trish Turlington. And so I'm going to work to share my screen and put just a little PowerPoint up just to help kind of bullet point all of the things we want to share with you today. And again, feel free to ask questions as we go along. So bear with me for a second. Just trying to find the right screen to share. I don't know if that's right. Sorry, don't use Zoom a lot. We use Teams, so it's like looking a bit different than normal. So let me see if we can share. Is this coming up at all for you guys? Okay, let me just make it in. I don't want to do presentation, but I don't want to show notes. Can I get rid of the sidebar? Can you guys, is it large enough? Because if I go to, let me see if I do the presentation mode. It's going to share a weird thing, so let's not do that. Any other suggestions on how I can?
In the view, can you say like to get rid of the left?
Yeah, if you go to the slideshow icon down there on the right, and then when it switches over, there's the display settings. Go ahead and click that to slideshow.
Yeah.
And then go up to where it's the bar that says display settings.
Mhm.
And then say, let's see, oh, usually it's there. Swap presenter, maybe try swap presenter view and slideshow.
There we go. There we go. Is that it? Is that better? Can you guys just see the, let me take you guys off of here. Are you seeing it? Are you seeing
Yeah,
this or not?
that's
Okay.
perfect. Yeah.
Is that
Perfect.
better? Sorry.
Yep.
Thanks, everyone. All right, perfect. So we have a number of different programs at Kennedy Krieger's, which we are our branching kind of name is we're Fairmount Rehab Programs, and we provide habilitative and rehab services intensively through a number of different programs. And Specialized Transition Program has kind of been what the nickname and kind of the name we've gotten for really all of our programs, but really we have a bunch of different names for them. So not to confuse you all. But we have acute programs through a Specialized Transition Program for more acute cases. And the one I circled is there because I feel like that is probably the program that you all would be most interested in, or that would be something that would kind of be more in this population of patients, which we sometimes call it a boost of therapy, where patients will come for an intensive 4-week bout of services between physical therapy, occupational therapy, speech and language. And typically it's not in an acute setting. And so patients will come in with a number of different abilities and needs, and they'll come for that 4-week boost. And I just list other ones just because we do have constraint therapy and some outpatient intensive where it's just one discipline and not that interdisciplinary program. And so just wanted you guys to see that we also do programs over the summertime as well. We typically like our school-aged patients over the summer. So the children who missing school during the school year would be really hard on them to be pulled out. So we reserve that time in the summer for that age group. We take the younger ones typically throughout the year since they aren't really pulling from school at that point. And so just a little bit more deep dive into kind of these programs. Like I had said, it's very multidisciplinary in nature. We have a number of people who work with the patients, a number of therapists, and we can consult out, which I'll show you in the next slide. And again, it's typically non-acute, so it's sometimes considered habilitative. So it's something where we might do it, once a year, once every couple of years, at different points in time. So again, it's not directly after an injury or diagnosis, but we do have that more of an acute type program as well. And so these are the services that are available at our intensive program. We provide physical therapy, occupational therapy, speech and language. We also have a neuropsychologist on staff who could do some testing if necessary and needed. We have an educational specialist, two educational specialists that work in our program who are consulted out and talk with families about impact on school and how they can help advocate in that area. We have behavior psychology support. So we have a pediatric psychologist who works directly and solely in our program, who sees patients individually and is just going to start a group parent group every week for the patients that are in our program. We have a physical medicine and rehab provider, so we have a nurse practitioner and a medical doctor, and they rotate, but they're there for the program, for the patients, coming in, assessing once a week alongside the providers. And so they, again, are not there to diagnose. So I'll be clear to say that, we're a short-term program, we're not long-term follow-up. So the goal of the provider is to direct care, but not necessarily, we're not diagnosing, prescribing medications and things like that. It's more like a medical kind of liaison between other medical providers that child might be following. If there's any suggestions or recommendations we might have, they might coordinate or communicate with those providers. We also have a nurse on staff who would administer, any needs like medication that have to be provided in the times that the patient is scheduled. Maybe they have G tubes or NG tubes that need feedings, anything like that. The nurse would kind of attend to some of those things. And also if we have patients with seizure disorder, we want to have emergency plan in place in case we would need to administer anything like that. We also have access to the pool. And so we try to work out with patients that it would be appropriate and safe to go in the pool, and it would be part of their plan. They would need to be cleared and then could go about maybe 1 to 3 times while they're in the program. It's nothing intensive on the aquatic perspective, again, because we share that pool with the entire hospital, and different people are signing it out. So it's something that we can get into, but not necessarily from an intensive perspective. So the land-based is really what's intensive. And then we can consult out because we have relationships with other clinics throughout the Institute. We can pull in assistive technology for access of device, or looking at, anything like assistive wise that they might need that might be helpful for them. Social work, we have psychiatry, we can consult out as well, and nutrition. And just so you know, from an insurance perspective, because many families will ask, well, how do we cover this intensive program? For our program, it's fully submitted to insurance. So there aren't like out-of-pocket costs from a sense of the program itself. It would be based on the out-of-pocket costs of your insurance. So we do a really detailed benefit check on all of the diagnosis codes and the CPT codes that we would be billing for the patient to determine whether or not we need authorization, kind of estimating what that might look like. As you know, intensive therapy programs take a lot of visits. And patients are using, for a 4-week program, 5 times a week, that's 20 visits out of their allotted amount. And a lot of insurances have a cap. And so if they do, we just want you to be aware how much we're going to use, how much you'll have left. So again, it's very individualized in that case, so that you're aware of what the potential out-of-pocket costs might be from a co-insurance or a copay, and things like that. And again, we do submit for the authorization if needed, and the referrals if we need them. So that's kind of how ours works for that. You might ask, like educational services, and like I talked about nursing, that's not something we bill to insurance. That's just part of the program. So those are things that are incorporated in if the child needs them. And then they're just part of the program. It is rolled in. It is not something that we charge families for. So if you want to know what a typical daily program looks like for us, just an idea of timing, the average length of stay for these types of like what we call like a boost, like an intensive bout of therapy, we've felt that 4 weeks is like optimal based on, research and kind of looking at where they end up just kind of plateauing. We want to we have that 4 weeks, first week's kind of that, initial evaluations and talking with the team in a rounds arena with all of the providers in one area, one room. And we round on them each week. So that very first week is kind of more of assessments and rounding. Then that last week is a lot of discharge planning. And then you've got that in between of intensive daily therapy. So we find that 4 weeks is just optimal for our patients. Again, it's 5 days a week, no weekends, Monday through Friday. And on average, our patients are attending 3 hours a day. And think about that with 1 hour per discipline. So if the child needs PT, OT, and speech services, they're going to get an hour of each of those. And then we might be adjusting their day based on what else they need. If they needed a consult with some work with education, or maybe they need some behavior psychology support or neuropsych testing, that's just kind of worked in the day. And we're back to back. So this is like an hour. The therapies are back to back in the day. And so families will drop off and they stay upstairs in our like nice little waiting area for families, or they're welcome to leave and come back and pick up their child. But we do provide opportunity in the beginning for families because they are a very big part of goal setting with our providers in the beginning to set up this very detailed plan of care for each child. So I always tell families this is not a cookie cutter program. It's not like the same for every child. It is very much tailored to the needs of the patient. I know parent caregiver not in sessions. We, again, some outpatient, intermittent outpatient, you're sitting with your child, you're there. But this is such a very high intensive program that we found it very beneficial, where it's solely provider focused on child to get the most out of that hour that we can and to get that full benefit of the intensive therapy. And sometimes families say, can we come back? Is this something that we can do again? And it's really tailored to when we think will be most beneficial for that child to come back for intensive therapy. So it's determined at the end. So we might say, it would be great at this particular point, giving some guidelines, or let's look at this in a year to 18 months for coming back. And we also look at what patients can tolerate. So sometimes if a patient can only tolerate 2 hours back to back, we might prioritize our services that way to get the most intensity in the things that are most important to that family to work on with the child. And so they might get like PT and speech or OT and speech in that way. And we have alternated as well to get all 3 services, just not getting everything every single day. And so just an overview of just some benefits, and I think we can dive in more with some Q&A, and some of our therapists can weigh in. But we're very functional in our approach. And we've tried to create meaningful goals for the patient and for the family, like to work together to create those, so that everything is kind of we have a meaningful, like working towards these goals that the family has set out for their child. And again, if a child is old enough and able to participate in goal setting, we definitely want to include them in that process as well. We also have an interdisciplinary team approach, which is really, really important and helpful because they're all working together. We're rounding, they're in the same space. There's carryover between different therapies. If a speech pathologist is working on something, it may be incorporated in another session, and vice versa. Everyone is really aware of that child's plan of care and what they're working on in other sessions. It's also good to kind of build that tolerance. And again, we do work in breaks. The therapists are really good about working with young children and figuring out kind of what's motivating to them. But it really builds up that tolerance, back to back therapies for multiple hours a day. And then consistently with carryover, like every day of the week. And that really talks about that neuroplasticity, because again, we're maximizing that by really repetitively working on things, making it fun, play-based, with the kids, but it's a constant repetition every day with those therapists. That's very important. And I mean, again, from an insurance perspective, when I try to sometimes I don't really have to fight all the time. It's typically whatever the benefit will allow. But we talk about how this is providing intensive therapy without having to spend the night in a hospital. And that's really sometimes more so for our acute patients, that are coming out to say, like, this is a nice way of providing that intensity without having to sleep in a bed that's not yours in a very disruptive environment overnight, not getting good sleep and good rest. They can get the intensive therapy with us. And then we talk a lot about the timings. Not only is the intensive program important and beneficial of intensity, but it's also like when you actually do this program, because, this is a lot of a commitment for families, for coming for a 4-week program, and for you to come and set everything aside. We want to make sure we get the most out of that program for you. And so we want to think about timing. And so when we get referrals in and we look at that, our providers are checking to say, like, do they have the right orthotics yet? Are they waiting on their AFOs? Are they waiting on a splint, something that would really help them? Let's wait and bring them in when we have what we need, so that we can really maximize it. Early intervention is helpful, but then we also, as they grow along and maybe are learning a new skill, or they've had a little decline or a loss of function and the family's concerned, that might be a good timing for intensive. We definitely want them medically stable. Our program is not set up for 24/7 oversight of medical instability or some really intense medical needs. We do take patients with all abilities and we try to make it work if it's complex, but sometimes it might require an inpatient stay or something like that. And we also look at major transitions, like sometimes we'll come right before they're starting school. There's a lot of goals and a lot of things and skills they might need to learn in preparation for transitioning, say, to going to school. And then we also know that families, there's a number of different intensive programs. There aren't as many as obviously we're very unique, a lot of us, like Napa too, other intensive programs throughout the United States. But we also try to encourage families to take a break in between intensive. So if you're going to go to one, we'd ask, that there be like a time span between going to that one and coming to us, because there has to be time to kind of allow the skills that the child is learning to kind of carry over in their familiar environment. Because, we think, oh, therapy, but being home is so therapeutic for patients. And we really encourage families to kind of whatever intensive program they've done to what they've learned to allow that time to carry over in the familiar environment where the child is in their home or in the community or school. Another thing is sometimes with trialing medications, we really want to optimize when the child would come for medication optimization. So if there's something we're going to trial, it's great for us to give the daily feedback, but if you're going to trial something, we like them to start ahead of time, because if they have a bad side effect, nausea, vomiting, anything that's negative, and they want to try something different, let's get the right med in first. And then when we, optimize that, or we kind of bring them in then. So that's a big important factor to think about when you're looking to go to an intensive program. And so I wanted to keep it brief so we could talk about, have some Q&A and people ask questions about things. But I did put up our contact, and I'm going to share this little slideshow with Lori, and she can kind of send that out to you all. So it has a contact information for Noelle and I, and we can always get questions to any of our therapists if it's therapy specific.
Well, thank you so much, Christine. That was great. I really learned a whole lot. I had no idea there was so many disciplines involved, and that's great. And you said that it's just typically 3 hours per day. Do you ever go more? Or you just try to fit in as much applicable disciplines to that patient within the 3 hours?
Yeah, the core therapies are the physical therapy, your occupational, and your speech, and that's your core. And then we'd add on from there if there's consults that they may not see them every single day. Like behavior psychology, they may be needed once or maybe 3 times a week. So again, their schedule could change and expand. But typically we're not doing like multiple hours. It depends on certain protocols, but for this particular bout of intensive, we wouldn't be doing like 3 hours of PT, if that makes sense. So it's really the hour of each. And I will tell you that that's been a really hard, with insurance, they typically cap off on your units of what you can bill per day. And so, hospital-based programs like ours are very expensive, and we don't want families to have to pay out of pocket unnecessarily. While we do have some families who want to, it's very, very expensive. So we try to, we give them what, we feel is most beneficial, and also keeping within the insurance constraints.
Absolutely.
Yeah.
So how accessible are these type of programs in the United States? Do you know?
There aren't many, because we have families tell us, but we're starting to see some pop up here and there. Maybe sometimes they're more single disciplined, and anybody else can chime in from my team, but I think we definitely try to keep a log of ones we learn about throughout the United States, because we have families that are living in California, up north all the way Maine. Like we definitely try to keep track of families that tell us, oh, I found this great, intensive program here, just in case, families can't always make the trek to Baltimore. They have to get housing, which we do help with for out-of-state patients. We help them find housing, and then hopefully some transportation if they needed a shuttle from one of the houses nearby, like Ronald McDonald. So yeah, it's hard. They're not plentiful. They're not like everywhere. But they're definitely throughout the United States, there are some, and we try to keep a log of some of the ones we learn about.
That's great.
Yeah.
So any questions from any of our attendees, Sarah or Suzanne?
I had no idea this was even a thing, so I'm still taking in all of the information.
Great.
How do you convince your therapist, like, so my sons have weekly therapy or whatever, that this is something that they would benefit from? I mean, I'm in Iowa. I think there's a place in Johnston that has something, but no one's ever shared anything about it or said, hey, this would be good for your son, or hey, this is what would involve, or hey, let's do this through insurance to see if we could get it.
So sorry, I just want to make sure I understood your question, Suzanne. Is that you were asking, how do you get the child engaged to want to do it? And is that what?
How do you get the PTOT speech therapists who they see weekly to say, hey, this would be a good thing for them?
Well, I'll chime in. Are you saying, how do you get your therapists to increase frequency, or how do you get your therapists on board to support you, like coming to Baltimore to do this or someplace
Well,
else?
probably not Baltimore. So we live in Ames, but there's the capital of Iowa is Des Moines, and I think Child Serve is a clinic that we go to once a week and have outpatient for my sons. But I was talking to another parent who has a kiddo, and she did something similar to this at the Child Serve that's in Des Moines. But like no one's ever told me anything about it.
Well, I think like I think Christine touched on it, that there's not a tremendous amount of research, but the research that is done to look at intensive therapies does show that it's beneficial to really, whatever skill it is that they're sort of like on the cusp of or sort of just got, and you really want to refine it, just that intensive every day working on it really helps the kids kind of like, master it enough that then they can spend the next whatever like Christine was saying, we don't always recommend kids do like back-to-back intensives, because we want them to take that time afterwards to sort of refine it and then generalize it to be doing, whatever the skill is or whatever the activity is in their house, in their school, out in the community. So like I said, there's not a lot of research, but the stuff that's there does support this.
Right. Well, and I would agree with that too, because the weekly therapy that they get isn't the change. It's the day in, day out that he does at school that helps with his growth.
Exactly.
And I think not all therapists know about things too. Like, I just think that not all therapists know what's out there or aren't thinking maybe with that hat on of intensive. Haley, sorry, go ahead.
Oh, no, that's fine. I think one of the things that we do, during that last week that Christine was talking about, that discharge week with all the discharge planning, we try to make a plan for the patients to return to the care that they had been receiving prior to coming to the intensive. So if they were receiving, weekly therapy, we will make the recommendation that they return to that provider with maybe some updated goals or some updated interventions that we have noticed that works for the kids. So usually we kind of do this bout of therapy in between, but they return to prior therapies. There are times where we say, you know what, let's just take a total break from therapy for a little bit. Let's let this kid really work on these skills, in a more functional environment, and then think about, another outpatient eval at some point. But typically the plan is for them to return to their previous therapies.
Yeah, and it's something that you can bring up to your provider too, because you might say, do you think I heard about this intensive program? Because it takes a lot of parent advocacy. I find sometimes families are finding us, right, and it's not always the providers that are knowledgeable and know and are bringing it up to the patient. So, I think that's helpful for you to advocate when you're in a session. If you wonder whether or not your child be at a place or there be a timing for it, maybe bringing it up with the therapist and asking, and seeing what their thoughts are about that program that you've researched and can bring that to the table.